Please give a massive welcome from Health Campaigns Together, Dr. Ashlyn Macklin-Dockey.
Well, thank you for taking your time out this evening for such an important issue. So I am a doctor in the NHS. I am proud to work in the NHS. And I am a proud socialist because of the NHS. The NHS for 69 years has provided a shining example to the world of what can be achieved when we make the decision to look after each other, to look after our communities, to put the collective good ahead of individual and corporate greed. And we have excelled at it. We have shown the world not only is it the most effective, the most efficient and the most affordable way to deliver healthcare, but it is what a civilised and decent society looks like. And that is why I am proud to be a socialist doctor in the NHS. But there's a problem with a socialist model. There's a problem when you have a neoliberal, profit-driven, conservative government like the one we have in at the moment, that doesn't care about the needs of you or me or our families, that only cares that the wealthy get wealthier. And that is why they have systematically tried to dismantle and undermine the NHS. But they are doing it by stealth, because they know they will not win the ideological argument about putting the collective good above individual greed. So they are doing it behind your backs. This failing, corrupt government cannot even tell you what they are doing to your face. That is why the NHS has undergone the biggest and longest financial squeeze since its inception after the Second World War. That is why 40,000 of my dedicated nursing colleagues, who you have just heard speak, are desperately on the poverty line, begging for a pay rise. People that look after our families, the sick. That is why a detrimental and dangerous contract was enforced on us junior doctors last year, despite our concerns about patient safety, in the face of lies by Jeremy Hunt. And that is why, what we have heard today, we have reached an absolute horror that 120,000 people have died unnecessarily in the sixth richest economy in the world. It is economic murder. Let's call it for what it is. Let's not stand by and watch this happen. Let us not tolerate it. Let us start to fight back. So a colleague of mine, another very compassionate nurse, said recently she is a nurse because she is a socialist, and she is a socialist because she is a nurse. And we work together in Health Campaigns Together. Last year, we organised with the People's Assembly the biggest demonstration in support of our NHS in its history. We have to remember that power yields nothing without demand. And that's why it starts from every single one of you here today, making your voice heard. We have to make sure that every single one of you is heard together, shouting very loudly and very clearly, so this corrupt and malicious government gets out of office, moves over for a socialist government in waiting. So repeat with me, say, save our NHS, get the Tories out. Save our NHS, get the Tories out. Save our NHS, get the Tories out. Thank you.
This year already, the what the staff are telling us is that the crisis level is already at the worst point now that it was over the winter crisis last year. Simon Stevens, the head of the NHS, came out a couple of weeks ago saying the NHS needs urgently £4 billion a year extra if it's going to survive. The government is choosing to ignore this, but I think it's an issue that they're very, very weak on. I've got 2 nurses for you, and then I've got 2 doctors for you. So I'm going to invite the nurses up first. Please give a massive welcome to Danielle Tiplady and Anique Simpson, who are activists in the Royal College of Nursing. Thank you. Sure.
Hello everyone. So I come here full of rage because I've just read in the Times that the Chancellor resists pay increases for public sector workers in the budget tomorrow. And we can warn them that this is our time. Nurses have had enough. After 7 years of austerity, our dignity and self-respect has been stripped away and it lays in tatters as people search for ways to make ends meet. 20 nurses a day apply for payday loans. On dispatches, we saw a nurse skipping meals because they could not afford food. And yes, nurses have been to food banks, and this is not complex like she might like to say. We simply do not have the money to get by. And we get told there's no magic money tree. Well, there is a magic money tree for 1.5 billion to prop yourself up in government with the DUP. I come here today for my RCN rep training, and we, for the first time in our 101-year history, have had an indicative ballot this year and voted that if the pay cap is not lifted, we will ballot for industrial action. Tomorrow, even if the government do lift the cap, it must not be taken from existing budgets. Our patients are suffering enough as it is. Any offer must be above inflation because anything below is an insult. And it must not come at the cost of our existing conditions. Jeremy Hunt has been talking about more money for productivity changes in our contracts, which is exactly what they did to the doctors. Enough really is enough. And today at the RCN, they said we will take the next steps for strike action. I'm a breaking point, and I don't actually know what else I can say to them in there. So I've brought my friend and my colleague, Anique, a fellow militant, goggy and radical nurse, to speak about her experiences on the front line.
Hi everybody. I'm a community nurse. I work in a district nursing team, and I look after your frail and elderly parents. I look after people who have been discharged from hospital after surgery. I look after cancer patients. Anybody who's housebound, we go and see. And I want to tell you something. Patient care is now suffering. Patients are your family, your friends, my friends and colleagues. The study previously mentioned in the British Medical Journal, published last week, that stated there have been 120,000 needless deaths over the last 7 years, and there will be 200,000 by 2020 if her government carries on with austerity and their cuts. The biggest factor the study revealed was the shortage of nurses. Why? There are 40,000 nursing vacancies in this country, 13,000 alone in London. Just listen to the numbers, 40,000 nursing vacancies. Why are nurses leaving the profession? I'll tell you why. Because over 7 years we have suffered a 15% pay cut. 15% over 7 years. Nurses can't afford to nurse. We're a graduate profession, but we are the lowest paid of graduates, university graduates. The Chancellor and Hunt said that maybe we'd get a pay rise if it was linked to productivity. How can we be more productive? We get paid, my team, for 7.5 hours a day. We are working between 10 and 12 hours a day to keep the frail, the vulnerable, the disabled safe in the community. Those deaths I mentioned, that is actually genocide. This government has blood on its hands. government is also selling off your NHS, my NHS. They are privatising it stealthily and openly to people like Richard Branson. They are running the service down because then they can get rid of it cheaply. The Tories think that by making us poorer, they will make us weaker. And I say absolutely not. It gives us the fire in our belly to fight them back. If the Chancellor thinks that by not giving nurses more pay, which will entice nurses back into the profession, please God, because we are losing nurses from district nursing teams every single day. If the Chancellor thinks that he can afford not to give us more pay, we are 270,000 NHS nurses. We can bring the government down. We are prepared to strike because we want to provide safe, holistic patient care. We want to be able to carry out our jobs daily without working stupid hours unpaid. We want to give compassionate care to our patients, and her government is stopping it. It's up to us and you to do something about it. Yeah, gloves are off.
So the gloves are off, and this is our time. This government are going to reap what they've sown to what they have sown to nurses. And what do we want?
More pay!
When do we want it?
Now!
What do we want?
Safe patient care!
When do we want it?
Now!
What do we want?
Safe patient care!
When do we want it?
Now!